Hi folks, today we're going to talk about another important topic, aesthetically important, which is the temporal points. Actually, to be honest with you guys, probably Killian was one of the first patients who emphasized and was asking me to do his temporal points. He was pushing so hard, and I understand. I understand that because they are so important. So if we look on this side here and we see the hairline in comparison or in relation to the temporal peaks, we can see what you will understand what I'm saying about. Hair loss is progressive. Androgenic alopecia, we tend to lose more hair with time. And one of the parts we lose or we recede back is the temples, temporal points. So imagine we created this line and we left this without any transplant. It's going to look funny. It's going to look straight line and another straight line this way. So we lose this shape, we lose this nice looking contouring to the eyebrows, to the hairline, to the face. I'm going to talk about the technical part, the way I perform it, and I will let Killian talk about other things. There's two ways of making the sites or the slits where we insert these grafts when we do hair restoration surgery. One called sagittal and one called coronal. And when I perform temporal peaks, I prefer to use the coronal slits, where basically the angle of, or the hair, where the hair exits, it has to be with really sharp angle, sometimes even down to 0. The reason is when we make the slit, the hair will, if we make a sagittal one this way, okay, the hair will tend to come up, so it changes the angle and the hair will stick out. When we make the slit this way, coronal way, it will stay down, it will look nice. Hair direction is so important as well. If we look at the direction of the hair, it's going down this way, it's not going this way. I see a lot of patients coming for repair where the hair went that way, or the sagittal technique where the hair came out. Killian, why you were giving me a hard time and insisting on temporal points? Tell me that.
Well, you know, the temporal peaks are really the most coveted, I think, part of any hair restoration because of youth. The profile is youthful. And really what they do is they provide not just focality and framing to a face, because framing is such a loose word. It's very vague. You know, we want to know more. What do they do? And they provide symmetry. They contour the eyebrows. This is a youthful component because we look at people who haven't lost their hair, teenagers, they retain these characteristics.
That's right.
And as we aged, and as you touched on, the temporal peaks recess back, what it does is it makes a face look wider. There's a loss of definition and youth. The face has a loss of identity, really. And I think by doing the temporal peaks, you retain that youth and sense of identity, because this is aesthetics at the end of the day, and symmetry is a very important
is a key. I totally agree with Killian here, and we managed to get him that dream temporal peaks. I hope so.
For sure.
We did.
More.
We're going to get more. Yeah, because actually he lost some of his native hair in this area. So during the second surgery, we did some more grafting. Usually it's a smaller session, and we did the FUE to get these fine grafts for that. So I'm glad everything went well, and let's wait for the final results in a few months.
It's a multi-step strategy.
Yes.
That is the key thing as a patient to know. It's not a once-off. This takes so many sittings over years because hair loss is progressive, and you go a little bit and tweak until the artistry is
Right.
perfect for your framing.
It's all about the confidence and the understanding and the trust in your surgeon.
Yeah.
Trust your surgeon, guys. You will be fine. Everything will work well, just like what Killian experienced. Thank you, and talk to you later.